Welcome to Public Health Matters, the show that addresses public health issues that matter the most to the citizens of Harford County. Real issues, real people, and the information you need to know.
Hello, I'm Rania Nassar, Public Information Officer for the Harford County Health Department, and your host for today's Public Health Matters, the show that takes a closer look at the public health issues that matter the most to the citizens of Harford County. Today's topic for Public Health Matters is vaccinations. We'll be discussing the importance of recommended childhood and adult vaccines, as well as resources available in Harford County. Joining us today is Dr. Jamie Seibel, Medical Deputy Health Officer at the Harford County Health Department, and Dr. Paul LaMonaco, local pediatrician here in Harford County. Welcome to our show, and thank you so much for being with us today.
Thank you.
Great. So let's get into just taking a moment to introducing yourself and your connection to the topic of vaccines. So, Dr. Seibel?
Sure. Hi, so I'm Dr. Jamie Seibel. I'm a preventive medicine and public health trained physician, and I serve as the medical deputy for the medical deputy health officer for the Harford County Health Department. And in that role, I oversee our clinical programs, including our immunization program for children and adults, and every day help with promoting health education for the community and access to care for our entire community.
Great. Thank you, Dr. Seibel. Dr. LaMonaco?
Dr. Paul LaMonaco, and I have been practicing in this county since 1989, so a very long time.
Yes.
I have served on multiple committees. In fact, I was chief of pediatrics at Upper Chesapeake, and I served with multiple committees having to do with child care.
Great. Just a wealth of knowledge with me today, so this is great. So I just want to kind of start slowly working into these questions. So just starting off with, what are vaccines and why are they an important topic to discuss with everybody today?
Sure.
So vaccines are probably the most important medical advancement in the last 2 centuries.
Mm-hmm.
They have saved countless individuals, and they are important in preventing diseases that could be quite dangerous.
Mm-hmm. And that's really important for public health, for sure.
Yes, from a public health perspective, the same thing. One of the greatest advancements that public health has ever had. Not only helpful in preventing an individual from having severe illness from a virus, but also now protects the entire community from outbreaks. So we consider it one of the greatest public health achievements.
Great. So why would someone need a vaccine? And I know that there's the conversations lately about, are vaccines safe, and is there any harmful ingredients in vaccines?
So vaccines help prevent diseases that, if received or if acquired,
Mm-hmm.
can cause irreparable damage to not only the developing brain, to the
Mm-hmm.
individual themselves. Not only that, but these diseases also can set you up for more dangerous secondary diseases.
Mm-hmm.
So for instance, measles, very, very tough disease, and complications from having the measles can set you up for pneumonias, meningitis,
Mm-hmm.
other types of infections. So not only that, but you are preventing other people from picking this up.
Mm-hmm.
So if you have an old person that's on chemotherapy and the child brings home one of these diseases to that person, well, now you've put them at risk also.
Mm-hmm.
And over the decades, vaccines have been wildly successful here in this country. So
Mm-hmm.
many people don't even know firsthand what the consequences of acquiring a disease like measles or polio or mumps could actually be. But we want to continue that. And so that's why vaccines are still important and needed, because as soon as vaccination rates, if they were to drop, we would see those diseases reemerge again. And that's the fear, and that's the reason why we continue to promote vaccines from year to year. And of course, they're studied extremely well. They're one of the most studied medical products or medicines out there. So they're very safe. Not only are they studied before they're released, but after release, they're continuously monitored. And their efficacy and safety is monitored over time.
Definitely grateful for the amount of research that has been done on this topic, and it's wonderful that we've looked into this for so long that we have a lot of education that we can provide to the community. So that's great. Now I know there's been conversations about oh well, let my kid get chicken pox before getting the chicken pox shot. So is natural immunity better than vaccination? Why or why not?
Yeah, so natural immunity is certainly not better than the vaccine itself, because natural immunity, and just to define kind of what you're talking about when you say natural immunity, that means acquiring the actual virus, the actual disease, and getting illness from it. So although that might provide immunity, you now are at risk for the severe complications of that disease, whether that be like for measles, like brain inflammation or really high-grade fever, hospitalization. When you get the vaccine, you're getting like an attenuated or a weakened part of the vaccine, of the virus, that therefore does not make you sick, so you still acquire immunity without the sickness.
Yes.
Yes, unfortunately I've been practicing so long that I used to see these diseases. In fact, I used to see measles also. And the feeling was, you mentioned chickenpox. Well, chickenpox wasn't a big deal. In fact, we used to have chickenpox parties and things like that. But people don't seem to remember that that there were kids that would have complications. One of the things I used to routinely see with chickenpox is that the kids would get a cerebellitis, so they'd walk around like unsteady. And measles, when I was seeing that, those kids were very sick. I mean, they were some of the sickest children that I had seen. Not to mention that they would be inadvertently put into position before anybody even knew they had the disease, where they could spread the disease to other more susceptible people.
So talking about vaccines for infants now, so which vaccines are recommended for newborns and which ones are recommended for children?
Well, it's highly recommended that most pregnant mothers in their last trimester receive the DPT shot.
Okay.
And that's because of the pertussis component. Pertussis is whooping cough, and if people Google whooping cough, classically they'll show you this 2 or 3 year old that's got this very definitive type of cough.
Okay.
The problem with babies or small children when they catch the pertussis is they don't cough. In fact, they just stop breathing.
Oh,
And
that's scary.
unfortunately, when I started way back when I was a resident, we would see several children a year that would come into the ER, stopped breathing, and they had pertussis. We don't fully develop a great immunity to pertussis, so we all carry it. And we don't get the disease because we've sort of gotten used to it, but we can transmit it to babies, and they're the ones that are the most risk. The other biggie that you can get early on in the newborn period would be the RSV. That's a relatively newer one. RSV is very tough on newborns. And again, it is recommended that mothers in their last trimester get the shot. That way it confers immunity to the newborns. And then we can start the RSV vaccine if needed, if the mother didn't get it, soon after birth. So that is one. And then the other one, I'm sure you can address this, is hepatitis B. This has got a lot of negative feelings to it because the feeling is, well, why should we get it? But that's another one that we should be giving soon at birth or soon after birth.
Yeah, and hepatitis B is one of the earliest vaccines that's recommended to be given. It can cause serious liver disease, and it's something that's preventable with this vaccine. So yes, hepatitis B is still recommended by the American Academy of Pediatrics at birth.
Could it harm a child to get multiple vaccines at the same time?
Yeah, so that's an interesting question. So every day, children, babies, adults, we're exposed to many germs of many types all the time. So our immune systems are quite adept at receiving different viruses and fighting different viruses all the time. There have been many studies showing that there's no issues with giving multiple vaccines at the same time, and those vaccines have been studied in groups, and it's been proven to be safe and effective. And one of the advantages of giving multiple vaccines at a single visit is because it takes the burden off of the parents from having or the family from having to bring the child even more times to the pediatrician. I mean, families are very busy, and asking them to come even more times to the pediatrician than needed can be stressful. So the vaccines that are given at the same time at a particular pediatrician visit have all been studied and are safe.
That's great. And it's great. I know that we put up a vaccine schedule for our viewers to see too, because there's just a lot for them to know. What are the possible side effects to the recommended vaccines? Is there any short-term, long-term side effects that we should discuss?
I think the studies have shown long-term effects are minimal versus if you were to acquire the disease, which could have severe complications. So vaccine problems as far as long-term are minimal, if any. The most common things we'll see, and I will get called about all the time after a vaccine, even though we tell people, we warn them, is you may, depending on the vaccine, you may run a little bit of a fever.
Yeah.
And the fevers can get to 101 or 102. And parents will say, well, can I give Tylenol like right after the vaccine? Of course you can.
Yeah.
Sometimes you'll get a local reaction, and it can be a little red, or they can get puffy. And sometimes we'll see that for several days. Again, we try to tell parents, this is what you might see, it's okay. And actually it's a good sign, because it means the vaccine took, your body's doing what it should do.
That's good.
Yeah, it's definitely that risk-benefit analysis. Clearly, the benefits of the vaccine, outweigh the very rare risks of some form of complication, and the reactions are typically, like Dr. Lamonica was saying, very mild and gone within a couple of days.
Great. So are diseases like measles, I know we just mentioned that measles and hepatitis B really that dangerous? How likely is it that babies will catch the diseases if unvaccinated?
Yeah, so they are. These are dangerous diseases, and in the past, like we were saying, in the past 2 decades, we're not really seeing them as much. But if you go past that, you did see them, and as soon as their vaccination rates, if they were to drop, they would you would see the increase in illnesses. So definitely still something that to take seriously, and they can cause a lot of damage if someone gets contracts it.
I can't stress enough. And you had mentioned earlier about, well, we don't see these anymore and people think we don't need it. Hepatitis B, you die from.
Yes.
Okay, you die. It is something that if you're vaccinated and you happen to get exposed, you're going to make it. But if you get hepatitis B, there's a chance that you're going to die. And in medical school, the hepatitis B shot was just coming out for me, and they didn't give us an option. You just got the shot because your exposure was high and basically it causes liver damage and possible death. So yes, we're not vaccinating because we feel like it. There is some rhyme or reason to why we do some of this stuff.
Yeah, and I just want to add too, in Harford County, the rates for vaccination for those two and for all of them are still very high. We have great rates of vaccination here in this county, but when you look throughout the country, what's going on with some measles outbreaks in predominantly unvaccinated areas, the numbers are high, and they say that if you're unvaccinated to measles and you're exposed to it, like 9 out of 10 people could potentially be contracting measles. So it's certainly a risk if you're unvaccinated and you come in contact with these viruses.
I really appreciate the conversation around this. Going into a real question that is now we see every day in the news, on social media, is there a scientific link between vaccines and autism, and where did that claim really originate from?
1998, I think, Lancet, which is a noted medical journal, came out with an article by, I can't remember the doctor's name, the researcher, where they looked at 12 children. And, and they said, oh, there's a relationship between this and finding the measles vaccine, the measles virus in the gut. The research was very poorly put together. There was no controls to look at that. And when other people went back and looked at the study, they said, well, some of these kids that they said were autistic didn't even meet the criteria. And number two, a lot of them had symptoms before they even got the vaccine. So that article was actually retracted, and numerous studies after that, and I mean worldwide studies with millions of kids have never ever shown an association between the two.
So here we are, vaccines do not cause autism.
They do not cause autism.
Are there any other information, anything out there that is about vaccines too that you'd like to address about any of that topic?
I mean, with the internet nowadays, you can find pretty much about anything. But what we encourage is for people to talk to their trusted healthcare providers, because there's so much information on the internet posted by people who are not medical professionals. But that's why we encourage people to have a strong relationship with their pediatrician or the family medicine doctor. The local health department provides trustworthy information, and there's many professional organizations like the Academy of Pediatrics, Family Medicine, ACOG, which is for obstetrics and gynecology, that all produce excellent evidence-based information for people to use. So, you know, our hope is that accessing that information, which should be easy to access online as well, can counter some of the information that people are seeing out there on the internet.
That is a really good point, because, you know, it really is, where are people getting information from nowadays, and, you know, teaching people too, like where the, you know, best information is for individuals. I love that you mentioned the, you know, the health department as a resource. We have some really good information on our website too, if anybody wants to check that out. So according to the Maryland Department of Health, vaccines have saved more than, well over 154 million lives, definitely even more than that, over the past 50 years, with the majority of those being saved are children, adolescents, children under 5. What do you think causes vaccine hesitancy in individuals?
Well, she alluded to it, the internet. So there's a lot out there, a lot of misinformation out there, a lot of confusion things, and people are willing to believe a chat room before they will believe a study or a physician. I used to have a doctor that used to yell at people, she's since retired, and would yell, "Who's the doctor here? Who is the doctor here?" So again, the feeling is there's a lot of misinformation that's bantered around in chat rooms, by Google, by all of these places, that is confusing to parents, and so their feeling is, well, why should I put my child through this?
Yeah, and that's a good point. You know, parents want what's best for their child, so they're trying to not cause harm to their child. So I guess, you know, also a good thing is that dialogue back and forth between a provider or a trusted healthcare professional and the parent and the family, and like hearing the parents' concerns, and specifically knowing like what's really on their mind, what's really bothering them about their hesitancy, and then really being able to like address that is really important. And it's I feel like it's like twofold. It's like presenting the facts to the parents for sure, but then also developing that rapport and that feelings of trust, which sometimes takes a long time to develop, but you know, with those feelings of trust, often facts are more easily absorbed and understood.
Great point. I mean, media literacy is so important to teach, and it's not even just with vaccines, it's with a lot of topics that we see nowadays. So that's both really great points to bring up. Switching gears now into human papillomavirus, or HPV. Can we just talk a little bit about what it is and why it's important to get the HPV vaccination when you're young? Can you get the HPV vaccination when you're older too as well?
Sure.
So Myself and a pathologist had run talks, this was prior to COVID, where we were talking about the HPV and its importance and acquiring it. HPV is one of these viruses that if you get it, you're sort of stuck with it for a while. I mean, your body may eventually get rid of it, but you're stuck with it a while. When the vaccine first came out, it was advertised as, you know, a genital thing and against genital warts. But as time has gone on, they have shown that it is a major influencer in cancers. And in fact, it is now the #1 cause of all head and neck cancers. So unrelated to genital warts or anything like that. This is one of the only vaccines we can give that prevents certain types of cancers.
Yes.
That's it now. And so, you know, that's a big thing. You know, if we can prevent acquiring a cancer, that's better than getting it and treating it. So that's one of the up things for it.
Yeah, I agree. That's a huge take-home message for parents, the fact that we actually have a vaccine to prevent against numerous, not, you know, genital warts was originally thought, and then it went to cervical cancer, and now we're seeing so many other cancers that it can prevent. So it's critical. And it can be, HPV can be acquired through sexual activity, so it's really recommended to give the vaccine to a child before they engage in sexual activity, as before they naturally acquire the HPV virus. That's the ideal time to give the HPV vaccine.
Yes.
Interestingly, you had mentioned when we give it, if you're before the age of 15, you only need 2. After the age of 15, you need 3. And what they've shown is that the children or younger people have a better immunity to less vaccines than older people. And I believe you can continue to get the HPV well into adulthood.
Agreed,
Yeah.
The feeling there is if you've had HPV, if you've gotten it, then the vaccine's probably not going to help you all that much.
So I want to talk about our Vaccine for Children program here in Harford County, and if you can talk a little bit about, you know, that program, Dr. Seibel, and just kind of explain how that works here.
Yeah, sure. So the Vaccine for Children program, also known as VFC, has been around for a long time. It's federally funded, and it's administered through the state health department to all the different local health departments. So you can then receive your vaccines at any of the local health departments in Maryland. So of course our Harford County Health Department, our location is in Edgewood. We do the VFC program. And so the VFC program provides any and all of the recommended childhood vaccines to children 18 and under who are either Medicaid eligible, so meaning that they either have Medicaid or they're eligible for Medicaid, or they're uninsured, or they're underinsured, meaning that they have insurance but it doesn't fully cover the vaccine, or if they're American Indian or Alaskan Native and they get the vaccine for free. There's a small administrative fee, but the actual vaccine itself is free. So it's a great program. We're very busy with that program at the Harford County Health Department, and the advantages of this program are that it reduces or eliminates the barriers to getting a vaccine, because you know, of course we believe that all children should have the ability to, you know, get a vaccine whether or not their family can afford it or whether or not their family has insurance. So it's a great program. That's a busy program, and we're able to vaccinate a lot of children in the county that way.
That's great. So we have VFC, which is Vaccine for Children, but we also have MVP, Maryland Vaccine Program here at Harford County. If you could also talk a little bit about that program too as well.
Yeah, so MVP, or the Maryland Vaccine Program, was very recently started. And that's a program that's run by the Maryland Department of Health, again, but carried out through all the local health departments throughout the state. And this now allows for adults 19 and older to be able to get vaccines. So this program is for adults who are either uninsured, underinsured, or have other barriers to access to vaccines, and we offer the whole range of adult vaccines through this program, and it's also a free program. So this program, like I said, it's only been around for a little bit of time, so we're trying to promote the program throughout the community so people know that if you are under or uninsured or have barriers, you can get these vaccines as well at the same location in Edgewood.
That's great. I know we're almost out of time, but if we can just talk about just some vaccines that we would promote for adults before we go.
Sure. Shingles is a big one. Of course, the flu vaccine, COVID vaccine, RSV for the older population, pneumococcal vaccine. Those are some of the big ones that we recommend adults get, especially as they get into the geriatric age, as people become more medically vulnerable.
Great. Anything else?
And we shouldn't forget adults should get a tetanus vaccine periodically, at least every 10 years.
Yes.
Yeah, and exactly. And for not only their protection, but like you were mentioning earlier, for the pertussis component for the grandchildren.
Yes, and I love getting my flu shot every year. I love staying up to date on everything, and we appreciate so much the information that both of you had shared today, and just all of the resources that we have here in Harford County. We're so lucky and fortunate here, and wonderful to have you both as amazing doctors to kind of spread that education. So thank you so much. And that is all the time we have for today. I would like to thank my guests on today's show, Dr. Seibel and Dr. LaMonaco. And if you'd like more information on vaccines, please refer to the resources page after the show. And join us next time for another important health issue that matters the most to the citizens of Harford County. Thank you for watching.
You've been watching Public Health Matters, brought to you by HarfordTV. Watch what matters.